and we're going to be discussing the mid-range theory of Cheryl Beck's postpartum depression theory. Dr. Cheryl Beck is a nurse theorist with a significant background in maternal newborn nursing. She began her nursing career after she received her bachelor's degree in nursing from Western Connecticut State University in 1970. She then pursued her master's degree in maternal newborn nursing and also received her certificate in nurse midwifery in 1972. 10 years later, Beck completed her doctorate in nursing from Boston University. Over the past 40 years, Beck has held several academic positions at various universities and now serves as professor at University of Connecticut. Beck has profoundly impacted the awareness and intervention of postpartum depression within the nursing profession. Beck has received over 30 awards for her research, having written over 100 journal articles and conducting multiple qualitative studies. Beck has profoundly impacted the awareness and intervention of postpartum depression within the nursing profession. She has received over 30 research awards, having written over 100 research journal articles and conducted multiple qualitative studies. She has also been inducted into the American Academy of Nursing and has served on numerous editorial boards for nursing journals. To add to her list of contributions to nursing, she has also served on the board for the Mars Society and on the advisory committee of the Donahue Medical Research Foundation. Beck's postpartum depression theory is classified as a mid-range theory as it identifies, explains, and makes predictions about concrete phenomena. Middle-range theories generate testable hypotheses that can be utilized within the nursing discipline. The testability of Beck's theory of postpartum depression is proven as new areas of research on this topic are continuously being investigated. Beck's theoretical sources are listed here. She obtained information from each of these areas: phenomenology, grounded theory, feminist theory, the earthquake model, and Robert Gable. Phenomenology is used during her theoretical research, and she determined the structure of the women's emotions during her postpartum theory. In her second study in 1993, Beck used a ground theory method in her research project, leading to the systematic generation of the core psychological problem of PPD, which was loss of control at that time. Feminist theory was another theoretical source seen throughout many of Beck's works, as she recognizes that childbirth should be understood through the woman's experience. Sichel and Driscoll's earthquake model was also referenced by Beck, as she related the combination of women's life experience to the concept of an earthquake, as moods can become unstable and erupt. Beck then recognized Robert Gable as an important theoretical source, as he assisted in the development and screening tools to predict and screen for postpartum depression. A couple of her primary sources we found were both published in nursing research, one in 1992 and one in 1993. The first article, The Lived Experience of Postpartum Depression, a phenomenological study, was whenever she first determined the psychological issues that women were voicing at that time. Her next article was whenever she actually discussed her development of the theory. She used a grounded theory method of the study and viewed how mothers interacted with their circumstances. This was published in 1993. Conceptualization of the nursing meta paradigm were listed as client-person, which has multiple meanings, with pregnant women and mothers. The environment, which is specific to the individual's personal context and life, but it can also affect the individual woman and have outward effects on the family. Health, which there were really no significant references to health itself, but except for mental health and holistic health. And then nursing, which is when nurses were able to read and understand this theory and apply it to their practice. As we go through the next few slides, you see that there were several nursing or major concepts and definitions within her theory. She had 22 major concepts, and they were listed accordingly throughout the PowerPoint. Next, we have the major assumptions, which again is the nursing, pursing, health, and environment. Nursing is the interpersonal interactions and obligations to view people we care for to achieve health and wholeness. Person, biological, sociological, and psychological wholeness. Health, the context of women's lives and consequences of women's response to life events. And then environment, which is individual or external factors outside each person. Next, we have the theoretical assertions and propositions. Beck's theory describes the importance of Driscoll's work relating to biological factors influencing postpartum depression. These assertions discuss the brain's ability to adapt to stressors and may or may not be biochemically regulated after long periods of stress. Women are biologically predisposed to mood disorders, and postpartum depression is caused by a combination of biological, physiological, psychological, social, relational, and economic stressors. Most cultures across the world perceive pregnancy as an exciting time in a mother's life, which hinders the mother from naturally delivering her own perception of her pregnancy. Postpartum depression risk factors can be identified pre- and peripartum with the screening tools. Postpartum depression can be prevented and or detected early to decrease the occurrence of adverse events to the mother, child, and family. To summarize the theory and the interrelationship of the basic concepts, including the goal of nursing, Beck's postpartum depression theory attempts to clarify and eliminate the contributing factors of this phenomenon. The theory describes the differences between postpartum mood disorders, loss of control, and risk factors associated with this diagnosis. The goal of nursing concerning postpartum depression is to first become self-educated in the topic, second, to educate the population, third, to implement screening tools, and lastly, to make accurate diagnoses to measure patient outcomes.
I'm Terry Britton, and I'm going to be discussing the schematic model. Concepts 1 through 2 are shown in the first schematic model. The first part is the postpartum mood disorders, which are postpartum depression, maternity blues, postpartum psychosis, postpartum obsessive compulsive disorder, and postpartum onset panic disorder. The lower half of the model shows concept number 2, which is loss of control. These often come in 4 stages over the postpartum period. The first stage is encountering terror, followed by the dying of self, then the struggling to survive, and finally regaining control. The second schematic model shows concepts 3 through 15, which are the risk factors for postpartum depression. As the model shows, each factor contributes to the downward slope in postpartum depression. Some of these risk factors include prenatal depression, a history of anxiety, the infant temperament, the self-esteem of the new mother, her socioeconomic status, and whether this is an unplanned or unwanted pregnancy. One or more than one of these risk factors can be involved, which predisposes the mother to postpartum depression. The third and final schematic model shows concepts 16 through 22. These include the signs and symptoms of postpartum depression: anxiety, insecurity, sleeping or eating disturbances, mental confusion, guilt and shame, loss of self, or suicidal thoughts. Not all of these have to be present for postpartum depression to occur, but these are warning signs for the caregiver to look for that might show that the mother has postpartum depression.
Hello, I'm Isla Williams, and I will be discussing the logical forms of this theory. Cheryl Beck's postpartum depression theory considers comprehensive and dynamic elements when formulating screening tools and concepts. She used deductive and inductive reasoning significantly to contribute to the conceptual process of her theory formation. The grounded theory approach, often used in middle range theories, are the least abstract and are at the practical level. Beck's use of this type of approach is evident through the abundance of its measurable data yielded by the implementation of her PDSS and PDPI systems. PDSS was her postpartum depression screening tool, and PDPI is the postpartum depression predictors indicator. Beck's work in postpartum depression displays inductive theory development through analyzing a particular problem that affects the population, followed by a focused solution. Beck began with a universal understanding of care and narrowed it to postpartum depression. She specified a substantive theory and continues to cultivate its applicability to nursing. Flaws identified for this work is inconclusive because of its fairly new development. Beck's theory is progressive and has proven to be a very beneficial tool in education, research, and practice. Now I'm going to discuss with you Beck's theory and its relationship to research, education, and advanced practice. Research plays an essential role on current and future professional nursing practice, thus influencing the educational process. Through extensive research, Beck demonstrated elaborate bodies of approximately 39 works from 1972 to present day concerning postpartum depression. Beck's works on postpartum depression have set the standard for knowledge on the topic at both the undergraduate and graduate level of nursing. A striking characteristic of postpartum depression is that it's covertly suffered in silence. The APN's job is to effectively implement the tools and theories provided by Beck's work to decrease the amount of missed and inappropriate diagnoses in practice. Deandra will further discuss implementations to the advanced practice nursing.
My name is Deandra Humphrey, and I'll be discussing the implications to advanced nursing practice. The most important implications of the postpartum depression theory to advanced nursing practice is recognition and prevention. Advanced practice nurses being educated on this theory is important because no single ethnicity, age, or socioeconomic status is exempt from developing this complex phenomenon. This theory proves any patient can be at risk for PPD. Since PPD can affect anyone, prevention can be achieved by recognizing risk factors of postpartum depression. The tool used to identify the factors is the Postpartum Depression Predictors Inventory, which is PDPI. The inventory specifically identifies 13 risk factors associated with PPD and allows the APN to ask a series of questions related to each predictor. Utilizing the PDPI every trimester is necessary because significant changes can occur throughout pregnancy. Assessment should also be continued for the first year after childbirth because PPD can be a latent development. And furthermore, when an assessment is complete and a mother is diagnosed with PPD, we must treat and not ignore the symptoms. PPD not only affects the mother, but can also affect other members of the family. Mothers diagnosed with PPD are less affectionate to their babies, and infants of depressed mothers can be more fussy. So treatment of PPD will help prevent detrimental outcomes for patients and their families. And our duty as healthcare providers is to prevent, identify, and treat PPD effectively. And next we'll have our hypothetical scenario. We have patient BC here, and she's a 33-year-old mother of 3. Your marital status, you're married, right?
Yes.
Okay. And what is your socioeconomic status?
I would say we're middle class.
Okay. And your self-esteem, how do you feel good about yourself as a person?
Sometimes.
Sometimes
I feel like I could be a better mother.
Okay. So prenatal depression, were you depressed throughout your pregnancy?
I feel like I was.
Okay.
I was sleeping a lot and I didn't really want to interact with my family.
So, anxiety, were you anxious while you were pregnant, during your pregnancy?
Some days I felt like it was just too much to handle with 2 children at home already and having another one on the way.
So was this an unplanned pregnancy or did you plan it?
This was unplanned.
And did you have a previous history of depression?
Yes, I did.
And your social support, do you feel like you have enough social support?
I have my family, but they live far away. I can talk to them over the phone, but they're not around to help with the kids.
So your marital satisfaction, how is that going? Are you okay with your marriage?
I am, but my husband is away for work a lot, and so sometimes I feel like we're distanced.
So your life stressors, are you currently experiencing any stressful events in your life now?
Well, my mother just died, and so that is a stressful situation that I'm handling right now.
And are you having any child care stress? Is your infant experiencing any health problems?
Not health problems, but she cries a lot more than the other two, and it seems like I can't get her quiet.
Okay. So, would you consider your baby fussy or irritable?
Yes.
Okay. And you already said your baby cries a lot. Okay. So is it difficult to console your baby or soothe your baby?
Yes.
Okay. So tell me about that. How is that?
It seems like whether she's fed, her diaper's dry, I do all the things I know to do with her, but she still cries.
So we just use a screening tool developed by Beck, and it's a series of questions. And based on the statements that patient BC has made, we now know that she is experiencing postpartum depression. And now we'll have our summary.
In summary, undiagnosed as well as inappropriately diagnosed postpartum depression can be a great source of despair for the expecting and new mother. Beck reflected on the fact that every woman's perception of her pregnancy depends on her disposition, which could be either positive or negative. Through Beck's thoughtful and extensive research on postpartum depression, one's pre, peri, and postnatal assessments may be comprehensive and imperative to the health of everyone involved in the pregnancy. Her works and theories are continuing to permeate nursing education, research, practice, and the healthcare field in general. She has made her works more accessible through telephone, internet, and translations in multi-language versions. Cheryl Beck's works in postpartum depression has enhanced the experience of the new mother, subsequently improving the statistics and client outcomes concerning postpartum depression.